name is Anne Russell. This is about the fourth in a series of videos I'm doing, one each week. I'm from the Russell Family Fetal Alcohol Disorders Association, which is a national organisation supporting parents and carers and people living with FASD. Just a quick divergence from what this video is about. Alcohol is a teratogen, which is a substance that causes birth defects. Recently, researchers have found that fathers play a critical role in the severity of FASD. This is something we didn't know before. If you want to become pregnant, plan the pregnancy, eat well, no alcohol or drugs for either person, and make sure that pregnancy is planned. Right, so this video is going to answer three questions that I'm asked a lot. How do I know if my child has FASD? Where can I go to get support? And what can I do, the parents do, to help? So, how do you know if your child has FASD? It's unlikely that you'd be going to your doctor to talk to him or her about FASD unless you had it in the back of your mind that your child has this condition. What's given you this idea? Have you done some research online? There's so much information out there about this condition, but it is the range of symptoms and the range of issues of FASD is huge, and so it can be very confusing as to whether your child does have FASD or whether they're just going through normal experiences for their developmental age. I think the best way to identify whether your child's got FASD is to prepare the screening tool that the rffada developed. It's on our website on the front page. I'd recommend that you print that off and complete it from what you know about your child. In a previous video, I've gone through the stages of life of a child with FASD through to adults. So I've already done that, but I will do it again just to give you an idea of the typical pathway of a child and teenager with FASD. So a baby who's been prenatally exposed to alcohol is likely to be quite small in size, premature, the baby cries a lot, doesn't sleep well, and may not feed well either. As a toddler, he's hyperactive, seems to be always in trouble, is kind of cute, a cute little fellow or person who likes to have fun, but he seems to always be getting into trouble. He may have a hearing problem, or you may suspect a sight or vision problem. As a school-age child, this is where problems are likely to become a little bit more obvious. Because now the pressure is on him. He's not just at home hanging out with mum, having a good time. He's at school where there are consequences and structure and things that have to be done. So it's likely that this is the time that, excuse me, you will identify that there's something a little bit different. So they may have trouble learning, they may have problems interacting with other children, they may be bullied or they may be the bully. I'll call this person a him because actually the majority of children with FASD are male. So he has trouble with homework. He either doesn't want to do it, or he has a tantrum if you mention it, or it just doesn't get done. And this is because he's been trying hard all day at school and his brain is just overwhelmed. He's overwhelmed, and when the thought of homework comes up, he just can't tolerate it anymore. So he may have a few friends, but they don't last very long. He may have one or two very tight friends, but generally speaking, he'll have friends and then he'll lose them again, and then he'll make new friends and he'll lose them again. And this is because he is acting a little maturely for his chronological age, so he may be, say, 8 years old, but in times of stress or excitement, he may behave like a 5-year-old. And this is usually what causes the rifts between friends. A preteen may have already tried alcohol and drugs. He could be getting out of the house at night and roaming around with his friends. He may have been already diagnosed with ADHD and be on Ritalin or dexamphetamine. And it may have worked for a little time, but then it's sort of stopped working. No matter what stage of life your child is at, they will benefit from a diagnosis. A diagnosis is critical, and particularly if you can get a diagnosis when the child is quite young. Early intervention is absolutely essential to avoid some of the secondary disabilities. So what to take to your doctor? I guess really what the most important thing is if you can do that screening tool, and if you have confirmed prenatal exposure to alcohol. So if you know that mum used alcohol while she was pregnant, if you saw her drink, if somebody else saw her drink, if you're the birth mum, then you know if you've used alcohol. So that's important as well. Any other assessments that may have, the school may have done some assessments, occupational therapy or speech assessments, they're important to take to the doctor as well. And your child's academic, social, medical, criminal and employment history if they're a little older, that can help as well. And another thing that can help is, does he have the facial features of full fetal alcohol syndrome? I won't go into those facial features in this video, we'll wait till another video and go through that then. So in Australia, if you're a foster carer or foster parent and you don't have information about the child's prenatal exposure to alcohol, it can get quite difficult. You need to be patient and persistent. Try and get it from the department, from the foster care organisation, because it's going to be very difficult for the doctor to make a diagnosis without those facial features and without that confirmed prenatal exposure. So the second point is, where do I go to get support? Well, the rffada, of course, will support you. We're on Facebook, Twitter, on the internet, obviously, on email. You can contact me anytime and I can point you in the right direction or give you some advice. There are a number of clinics established now in Australia, which is wonderful. That's only happened just recently in the last 12 months or so. There's a clinic on the Gold Coast. There's one clinic in Perth and several other people diagnosing in Perth. There's a clinic in the Kimberleys. There's one opening up on the Sunshine Coast, and there's one in Sydney. So if you want the details, just contact me or just Google diagnostic clinics. They should be there, should be available for you. So the third point is, what can you do or what can I do to help as a parent? There are lots of things you can do. And if you put into place some interventions and strategies that are FASD friendly, if your child doesn't have the condition, it's not going to matter. It's not going to hurt a child who doesn't have this condition. So you can rest assured that anything that you put into place for FASD, it won't hurt anybody who doesn't have this condition. But like any condition, the best way to help your child is to learn as much as possible about it. Read everything you can. Take a look at your child and see how he's behaving at particular times. What triggered it? What caused that behaviour? How did that all come about? You know, a child who comes home from school and flings down their bag and has a tantrum, starts crying and running around, if they've got FASD, it's not bad behaviour. It's because they're overwhelmed from school and from everything that happens at school. So have a look at that behaviour, see if you can find a reason for it. Learn as much as you can about the interventions that other people have found to work. There are environmental accommodations that can be utilised, but combine it with your own understanding of your child. Remember that your child is unable, not unwilling, to do some of the things that you want him to do. Our video next Friday will be about practice and wisdom-based interventions. So some of the things that you really can do to help a child with FASD. I think that'll be a very interesting video for people who have children with FASD or suspected FASD. If you're interested in quality professional training on FASD, please contact me. My name is Anne and my phone number is 0412 550 540. Thank you very much.